as a perspective as a medical retina specialist and doing comprehensive ophthalmology, I just want to sort of share with you how I use Retina Workplace and how I find it helps with diagnosis and delivering patient care and education in my clinic. So, and then I was concerned about, as we zoom in, and then you can synchronize the images and zoom in together. There are changes here on the left with the optic disc, which looks like, fine fronds of new vessel. Neovascularization is what clinically, very fine wispy vessels. So you can see beautifully the color picture with the fine wispy vessels on the disc, the angiography showing the new vessel, and you can see on the B scan flow through that new vessel on the disc. And you can see here with the overlay of the images again, synchronizing the color retinal image with the OCT, you can see a large subretinal hemorrhage. There was already hemorrhage at diagnosis. So I've done a sectoral PRP. You can see area here of a reddish elevated lesion, which looks like neovascularization of retina, NVE, and the contiguous lattice degeneration. And the patient can also see why they've had treatment. Being able to document whether in this patient, if they're getting new PIC lesions or if there's enlargement of scars or satellite lesions of toxo lesions. And then she was switched over to aflibercept and shown in green now. And you can see that improvement of the macular edema. So I find that aspect with a lot of the injection patients very helpful. And then, as you know, you can then drag up at the time points different scans you want to look at, and then it will show that one. So you can just change the 3 different time points you want to look at. You can see here, sort of like time-lapse picture, you can see on a color fundus photograph, the areas of GA just slowly progressing, which we have been powerless to treat up until now. So you can see that significant progression and the autofluorescence again showing that. So this is a patient with established GA. You can see the color fundus photograph, the autofluorescence. And so we talk about multimodal imaging. We want to be able to have all that in the one place, such as Forum, so we can correlate and synchronize and make most use. So you can see here the autofluorescence, and of course you can synchronize the OCT-B scan over autofluorescence as well, as you can do with angiography and so on. So we're going to really have to closely look at all those modalities, ideally synchronized in something like the Forum. So that's it. Thank you very much.